Tropical Cyclone Idai destroyed lives and laid to waste infrastructure across a huge swath of southeastern Zimbabwe. Healthcare facilities in Chimanimani, Chipinge, and Buhera districts experienced the full destructive force of the cyclone at the same time that they had to deal with COVID-19 pandemic and an unprecedented influx of desperate patients. The effect of that loss of capacity were deeply felt in maternity departments and have lingered on for years. The Health Assistance Project for women and girls affected by Tropical Cyclone Idai in Zimbabwe is a China aid-funded project and implemented by UNFPA in partnership with the Ministry of Health and Childcare. It worked to provide maternal health services in 81 healthcare centers that were affected by the cyclone. Birchin of Bridge Hospital is in Buhera district, officially serving a catchment area of 18,000. But because it is at the southern tip of the district, at the meeting point of Buhera, Chipinge, and Bikita, as well as Manicaland Province, it has to serve a much larger population. The maternity department at the hospital was under the most strain, especially after Cyclone Idai. The maternity waiting home, designed to cater for 15 mothers, was badly overstretched. The Health Assistance Project refurbished the damaged maternity infrastructure as well as building new structures. The old maternity waiting home has been refurbished with a fresh coat of paint, new interior fittings, and new beds. A modern water toilet system has been built to replace the pit latrines that were there before. The cooking and washing areas have been upgraded with smart floor tiles, new doors, new water taps, and better wheelchair access. Chipinge District Hospital has continued to feel the strain of increased admissions in the maternity department since Cyclone Idai. The 7-room maternity waiting home, designed to house a maximum of 28 mothers, sometimes had to cater for 70 waiting mothers, resulting in systems falling apart.
Quand je venais ici, je vois pas de toilettes, pas de kitchen, pas de bathroom, pas de robinet. Nous avons resté de ce côté. Quand on va finir ici, nous allons arriver ici.
The Health Assistance Project has transformed the maternity waiting home. The sleeping area, toilets, and cooking areas were refurbished and water tanks were installed. Due to high demand, there is still a need to expand or build new sleeping areas to meet the demand. The maternity waiting home also serves pregnant women from Tongogara refugee camp. In the immediate aftermath of Cyclone Idai, Mutambara Mission Hospital Maternity Department functioned like an emergency department, as women in labor or close to delivery were airlifted in from across Chimanimani and Chipinge districts.
So many of them, mostly those that are coming from that far Chimanimani, they just come here with nothing. They don't have any food, nothing for the oncoming baby, even nothing for themselves. By then, the roof was almost down. Everywhere was leaking. Even the toilet they are using then was terrible.
At Mutambara Maternity Waiting Home, the sleeping block, kitchen, toilets, and laundry area were refurbished. Leaking roofs were repaired and repainting done. In addition to the refurbishments, the maternity waiting homes received beds, cabinets, mattresses, and linen. On-the-job training and clinical mentorship on emergency obstetric and neonatal care were another major pillar of the project. focusing on strengthening skills and ensuring provision of quality maternal health care.
We have had a couple of BEMNOC trainings done off-site and some done on-site with the support of UNFPA. And we have also ongoing on-the-job training that is happening here at Bechnaf Bridge, whereby our maternity staff and our midwives engage at times weekly to revise the difficult topics.
As you said yesterday that you wanted to have a session on management of PPH but using an anti-shock garment.
Since the cyclone, Mount Selinda Mission Hospital Maternity Department has worked to increase its capacity to deal with emergencies like postpartum hemorrhage, in which women excessively bleed during or after childbirth. This is a leading cause of maternity mortality in the country. The Health Assistance Project provided vital equipment and funded training of midwives on the use of equipment like the non-pneumatic anti-shock garment, a low-cost first aid device used to stabilize women who are suffering from obstetric bleeding and shock. The Health Assistance Project restocked depleted pharmacy stocks across 81 health facilities at primary, secondary and tertiary levels.
Every 4 hours and 3 centimeters.
The ultimate goal of this project was to ensure continuity of service provision to curb maternal mortality in the cyclone-affected districts. Over the project duration, it procured and distributed with critical maternity health medicines and equipment. It contributed to 63,327 deliveries and 8,567 cesarean sections in the affected districts. Built the capacity of 296 health workers in the provision of emergency care to pregnant women. Built capacity of 42 health workers in using the anti-shock garment. Refurbished 3 maternity waiting homes, namely Mtambara Mission Hospital, Chipinge District Hospital, and Birchenhoff Bridge Hospital. 10,498 pregnant women accessed maternity waiting homes during the project duration. Procured and distributed surgical masks and disinfectants to the 81 facilities for COVID-19 prevention and control.